You no doubt are familiar with the redness, the swelling, and pain.
But you may not know there are several types of pink eye, and if it is misdiagnosed, it can bring the guesswork out of treatment.
Vincent Savage played football for Westbury High School last night with pink eye. Today, he was miserable.
Oh, man, it really hurt. It gave me a lot of trouble this morning.
Warren Clark had pink eye in both eyes. He saw 2 doctors in Canada, but didn't get the right treatment. 2 weeks later, he's lost vision in one eye.
The left eye has still got a blurred vision.
Clark, on a business trip to Houston, went to Dr. Alan Panzer. The right eye is now okay, but the left eye isn't.
The pain's gone out of the eye, a lot of the redness has gone out the eye. It's only the sight which I'm a little concerned about.
The correct treatment could have prevented Clark's vision loss.
They gave him an antibiotic, which is a wonderful drug, but he didn't have a bacterial infection. He has a viral infection.
Panzer is now treating Clark for viral pink eye.
I expect the vision to be much better by Monday.
Panzer uses a new quick test on his pink eye patients. He takes a tear, then tests it to see if it's a virus or bacteria that's causing the conjunctivitis. The treatments are different. When he tested Vincent, in 5 minutes, it showed he had viral pink eye.
It has a second faint red line, which indicates the presence of adenovirus in his eye.
He used drops to numb the eye, drops to remove the virus, and dilated his eye to stop the painful spasms.
You're going to put that in every hour today.
Every hour, so I can't go to school?
You're not going to school. This is very contagious.
Bacterial pink eye is easier to treat.
If it's bacterial, we can use the antibiotics and send him back to school because nobody can catch his bacterial infection.
What if your red, itchy, watery eyes are not caused by pink eye? In Houston, it could easily be allergies. Then the eye doctor can give you a steroid drop or an antihistamine drop. Christy Myers, 13, Health Check.
Well, pain is the big clue that you may have pink eye. Along with the pain, pink eye symptoms include swelling and redness. And as Christy said, if your eyes are just red, dry, and itchy, but there's no pain, you may be suffering just from allergies.
Oh, when we come back, the story.
Bugs that make it uncomfortable for you to see.
The rodeo round.
What you need to know about these microscopic bugs that make it uncomfortable for you to see.
The rodeo roundup is brought to you.
Guys, and nothing makes it better. Listen to this. Tiny mites that naturally occur on our skin can sometimes get into your eyelashes and cause an allergic reaction.
It is a gross but a very common problem. Health Check reporter Christy Myers found an easy way to get rid of them.
It really bothered me at all.
Fernando Barajas has just learned he has eye mites.
You have the feeling that something is bothering you. You rub your eyes and it gets worse.
Previous eye doctors missed the mites in his eyes. They're called Demodex.
They're arachnoids, 8-legged creatures, and they have a mouth and 8 legs and a body, and they can walk around on your body at night, but they're very slow moving, and they typically just sort of live in the hair follicle.
Fernando says they made his eyes dry and itchy.
A lot of them live in a single hair pore.
This is a picture of Barajas's lashes. The crystal-looking dots at the base are dead mites, and they are causing the itch.
Wow, this is incredible.
There's a definite yuck factor. It's really gross to think about. And not all dry eyes are caused by these little mites. But if you have dry eyes that don't get better or that affect your vision, it's a question that's worth asking.
I just didn't expect anything like that.
Ed Blackburn finally knocked out his Demodex problem.
I see better. I don't have cloudy vision anymore.
Blackburn used tea tree shampoo and a tea tree oil directly on the lashes to kill the mites.
1,000 times better.
Barajas will start using the tea tree oil too.
And then you'll apply it to your eyelash. You do this in the shower so that you can rinse it off quickly because, as you can see, it smells pretty bad.
Oh, terrible.
But Panzer says nothing else really kills them.
Honestly, I just cannot believe for all these years I've been living with that.
Christy Myers, 13, Health Check.
Stories like that make me want to scratch for some reason. I guess Tim too.
You just get your eyes start itching, you know?
Right. It'd be a bad thing for a Major League Baseball umpire to have eye mites. Here's Tim Elton with
Some have been accused of.
Tonight we take a look at the siblings of children with autism. How does it affect their childhoods? Once again, here's Melinda Spalding.
Nurturing their children's talents has always been a priority for the Panzer family, but they learned early on that not all nurturing is alike.
Our
philosophy has always been different things for different children.
The differences between kids Robert and Jenny go beyond their favorite instruments, their favorite foods, or even their age.
I'm 16 years old.
Robert has autism. Jenny doesn't.
I'm kind of used to it now. I mean, I've grown up with it, so I don't really think it's a big deal.
Robert needs more therapy, more money, more attention from his parents.
When I was younger, I used to take it personally, and I used to want a lot of attention, and he would get most of the attention.
Their challenge, making sure Jenny gets what she needs as they pursue the best options for Robert. A challenge that's become easier with time.
I took wisdom where I could find it.
To Jenny, when Robert was very young, it certainly had to seem, and it probably was true, that he got a great deal more attention. But I remember many times saying, but Robert doesn't get to go spend the night at other people's houses. You do.
They soon learned just how strong the bond between siblings can be.
All the time Robert was in therapy, the therapist would say Jenny's his best therapist. And so I think that makes it much easier if the other child isn't removed from the situation.
Today, Robert and Jenny are just like any other brother and sister in their neighborhood. They go to school together. They tease each other.
You like her driving? Is that what he's...
No. Jenny is not a good driver.
But most importantly, they both get what it means to live with autism.
I'm pretty understanding when he needs his attention, and when I need my attention, my parents always give it to me either.
You can't walk away from this duo without knowing two things. Robert really admires his big sister.
So Robert, what do you think of your sister and her friends when you see them at school?
They look awesome.
And Jenny looks out for her younger brother.
We sometimes take field trips together. If with his class I can go with them, and sometimes we see each other at lunch.
Their closeness gives their parents a sense of reassurance and some concern. As Jenny prepares to go off to college,
I want to go. But she's gone the whole year.
The Panzers can't help but think about the future.
I think you have to be concerned that she winds up taking more of the responsibility than other children would.
Right now I'm researching transition services and issues that may arise as he gets older. But I think Jenny will be a support to her brother throughout his life.
Different things for different children. Melinda Spalding, Fox 26 News.
Currently, 4 families who have children with autism are blogging about their experiences on our website, myfoxhouston.com. You can find a link under the Health tab.
Do you have dry, itchy, watery, burning, tired eyes? Well, you may have dry eye syndrome, and while eye drops may provide temporary relief, there is a painless, long-term solution. The 5 most common causes of dry eye syndrome are overactive tear drainage ducts, aging, the environment, contact lenses, and certain medications. A procedure called canicular occlusion can bring many sufferers of dry eye permanent relief. Small plugs are placed in the tear drainage ducts so the eye receives more natural lubrication. A simple test called the lacrimal efficiency test can determine if canicular occlusion would help you. Small plugs, which dissolve in 4 to 7 days, are placed in the drainage ducts. If you truly have dry eye, you'll feel better immediately. Dr. Alan Panzer believes this beats other tests.
The lacrimal efficiency test differs in that you are plugging the drain of the eye, and if the symptoms are then alleviated, then you have a true provocative test for dry eye, as opposed to a subjective or objective measurement of the tear production.
Not only can dry eye be remedied by this procedure, but related symptoms involving nose, sinus, and throat may also improve. Trumping